My name is Mary Leslie English. I'm the VP of Public and Donor Relations for Hospice of Piedmont and Hospice of Randolph. And I want to spend some time today talking to you about why your story is important and how you can be a good advocate for our organization. Why it's important to understand what it is we do so that you can share with other folks in our community, friends and family, about what we do. I'm going to start out by talking with you about a concept that our CEO actually developed called Give with Heart. This is a value statement, something that our entire organization learns about, from volunteers to board members to staff. When you onboard with our organization, you learn about Give with Heart. All of you should have a booklet. It might not show very well. A booklet if you came for your interview yesterday, and we're going to walk through this booklet, not every word of it, so I encourage you to spend some time with it on your own. This is your resource. It's full of a lot of just really rich detail. If you're a detailed person, lots of good information. This is sort of your cheat sheet, your textbook for some of the most frequently asked things that people want to know about our organization. So, but I'm going to start with our, there we go. So the key to Give with Heart is it starts with you. Every interaction you have as a volunteer will help form lasting experience for our patients and our families, their families, and your fellow team members, meaning our care team and your fellow volunteers. So we all play a role in hospice and what we do here. And as a volunteer, you are important, and your commitment to this is really important. If you follow along in your booklet, you'll see I'm going to go through the give words. I'll start as they're on page 4 of your booklet. We're going to start with grow. I grow my commitment to personal development in support of our patients, families, and my fellow volunteers and team members. So committing to grow means that we learn from one another, as well as our successes and our failures. Often we have opportunities to learn from good things that happen and from things that maybe we should have done differently. And acknowledging that, we as an organization believe is really important. We grow when we expand our knowledge base about the organization, our services, and how we care for our community. I encourage you to really grow in your knowledge about what we do, which you're going to hear more about later. Really embrace trying to understand hospice. Hospice is a huge type of care with a lot of different intricacies. Very hard to learn it all immediately, so growing in this will be a process, but you'll have lots of great opportunities for education as you are a volunteer. Next is inspire. I inspire patients, their families, and my fellow team members to seek fulfillment and achieve personal success by embracing our mission, which we simply say our mission is to connect individuals to the care they need on the terms they choose. When we're inspired, when we're inspired by something that's so much bigger than ourselves, then we are likely to inspire others and create important connections with others. We want you to be inspired by our mission. We want you to be inspired to help people understand what we do, to understand the misconceptions and the myths associated with our type of care, and to have a passion about helping people understand those things. Next is value. I value the contributions of my fellow volunteers and team members, as together we share the responsibility for the needs of our patients and families. As we address challenging needs of our patients, we are sure to show respect for their wants, needs, and priorities. This is a foundational concept for our organization. We are always sure to understand people's wants, needs, and priorities. This is how we understand their goals and their care. This determines so much of what we do when we're providing care. It shows value for people. We value people. We value what's important to them. And communication is really key in showing value. So our close communication with the care team promotes the patient-centered care and helps anticipate the ever-changing needs that our patients inevitably face. So communication is going to be really important in what you do as a volunteer. You're going to be a different set of eyes and ears when you spend time with patients and their families, and it will be a really important perspective for you to share in your documentation about visits. It'll be important for the team members to hear what you're saying as a volunteer. Empower. I empower my fellow volunteers and team members to use the knowledge, skills, and resources of the organization to excel in providing the best possible experience for our patients and families. So when we're empowered, we believe that you excel. And when you're given the resources, the education, the support you need, we believe you'll excel. And that's really important. We want you to feel like you have what you need to be the best volunteer you can, to provide the best possible experience. Also, empowering one another leads to creative and innovative thinking. This is something I think is really important about our organization. We're constantly evaluating what we do, why we do what we do. Is there a better way to do what we do? And we want our staff and our volunteers and even our board to feel empowered to be part of having these conversations about how we can use all the resources of our organization to provide the best possible care. So moving on in your booklet, I want to spend a little bit of time talking about being an advocate on page 8 of your booklet, about giving and connecting as an advocate. So what is advocacy for our organization? It's helping create new and bridge existing relationships to individuals in our community and just the community itself. It can take on a few different forms. We call it community advocacy. It's just helping us build our brand identity in the community. There are 22 hospices that serve our 8-county service area. That's a lot. That means there are a lot of names out there in the world that we're serving. And so we very much are always working to build our brand, our name as the one that folks will choose for their service. Donor relations advocacy, it's understanding that no two hospices are alike. It's understanding that we are a not-for-profit organization, and there are for-profit organizations also, but as a not-for-profit, we rely on the generosity of our community to help support us. So it's important to know how to give back to our organization. So spending some time understanding that too. Social media advocacy, we understand that social media is such a big part of our lives these days, and folks use that avenue to really share about the things that they're involved in. So we hope that this type of advocacy could be something that you may be willing to do to share about why you volunteer, or things that you've learned about our organization that you think is important to share. On page 10 of the booklet, there are just some tips for being a good advocate. So I would say, remember that not all hospice agencies are the same, and always refer to our organization as Hospice Piedmont or Hospice Randolph, not just hospice. Never talk poorly, as always, about another hospice organization, whether they're for-profit or not-for-profit. You possibly will hear lots of different stories about different kinds of care that folks might get from other hospice organizations, but we try to remain friendly and nice and respectful of everyone. Wear your name tag proudly, and remember, as ambassadors, you're all marketers. Everyone has name badges that help them be recognizable. When you wear that name badge, folks will think that you have all of the answers. So you always get asked. I think just last week I ran an errand at lunch and usually would take my badge off, but had left it on. But had the opportunity when someone inevitably saw my badge and said, "Oh, you work for hospice." Oh, I know that's so hard, but I was able to give them a few sentences to reframe some of that thinking that actually it's really great. We do really great work, and talk about the positive aspects of what we do. Number 4, speak positively about the organization to family, friends, neighbors, church, and club members. Anywhere that you're involved, let people know about what it is we do. In normal times, we offer speakers to groups, and hopefully this will be something that we will get back into, but we love to go and do educational talks for different groups. Let people know how to make a referral. Number 6, suggest bereavement services to those in the community with bereavement needs. And number 7, when you're unsure about how to respond to a question or concern, call our office and ask. We know that you will not have all the answers, but we want to be supportive of you and your conversations about what it is we do. So yes, always direct folks back to us. The volunteer department is a great support system for volunteers. I'm going to move on to the next kind of portion of the booklet. On page 11, you'll find a section called Know Your Stuff. So I believe that in order to be a good advocate, you got to know what you're talking about. So this section of the booklet really truly is those FAQs that we get from folks a lot. And so I'm going to go through a few of the questions randomly. I'm going to try and follow along in the booklet so I can tell you where to look, where to follow me. But so I'm going to start on page 12. Is 6 months the maximum benefit? And the answer to that is no. In order to be a patient for our organization, you have to have a prognosis of 6 months or less. That does not mean that in 6 months, if you have not died, we are no longer providing a service. Our doctors are required then to just recertify that you're still terminal. And we have folks that are on our service for even months and months, even years in some cases. And I know someone had referred to the fact that our services are so much more beneficial when you're on our service longer, and that really is true. In the last days of life, it's hard to offer everything that we have to offer to a family. So when they're in our service for months at a time, we have a better opportunity to prepare them, to help them along, and all the different, social workers have a chance to see them, chaplains have a chance, volunteers have a chance. So we've actually had the opportunity to spend a lot more time with the family. Next on that same page is, where is hospice care delivered? And we like to say that hospice care is delivered wherever the patient calls home, whether it be in their private residence, a skilled nursing facility, an assisted living facility. Sometimes, we provide care in a hospital setting, and then we also provide care in our IPU, or our inpatient units. We have 2. Hospice Home at High Point and the Randolph Hospice House at Ashboro. On page 13, who can refer to hospice? And really anyone can call and inquire about service, can call our admissions and referrals department and talk about themselves or a loved one who may need hospice services. Ultimately, a doctor's order is needed to start you in the program, but anyone can call and ask the questions about eligibility or something that may be going on with their loved one. Who pays for hospice? So our largest payer for hospice is Medicare. Hospice is a benefit under Medicare, and so the majority of folks that we take care of do have Medicare. We also take Medicaid and private insurance, so some private insurance plans have a hospice benefit, but also we have folks that aren't able to always pay, and so therefore it's very important that we receive support from our community, and that folks understand that there is a need, that there are some folks that do have unreimbursed cost, and we don't turn any of those people away based on any of their ability to pay. So we take on that cost. Is hospice giving up? Over on page 14 in your booklet, we say definitely not. We believe that choosing hospice is really a very empowering decision for patients and families. It is going back to that idea of, understanding wants, needs, and priorities. It's deciding for someone it might be deciding to go home and not take any more treatments, but to live the end of their life in the way that they determine. We really work to try to reframe hospice as not something that's giving up, sad. Although I understand that death is sad, it can just be such a positive thing for folks. Is hospice just for cancer patients? So whenever hospice was started about, I would say, the movement a little over 40 years ago, the majority of people who were being cared for by hospices at the time were cancer patients or AIDS patients, actually. But now only about 33% of our patients during a year's time actually their diagnosis is cancer. We care for folks with many different diseases, from neurological, Alzheimer's, to things like stroke complications, heart failure, COPD, lots of different things that we work and care for folks. Also, does the service end at the time of the patient's death on that same page? And so our services continue after a patient dies for the family, and those are through our bereavement, our grief counseling center, which I know that you all got to hear some from our bereavement folks. And Medicare requires that we offer 13 months of bereavement for families of people that we have served. So we do that in a variety of ways, from mailings to one-on-one counseling to group counseling and other special bereavement events. So what I believe, we offer a very robust program to offer great support for those that we've served even after their loved one has died. On page 18 outlines the programs that we actually offer here, Hospice of the Piedmont, Hospice of Randolph. Our key, biggest program really is our in-home care. About 90% of our patient care days are provided in someone's home setting, whether that be in a nursing facility or in their private residence. Also, our inpatient units, Hospice Home at High Point, which is an 18-bed facility here in High Point, and the Randolph Hospice House, which is a 16-bed facility in Asheboro, offer a couple different levels of care, but truly the main goal of our IPU is to offer care that can't be offered at home, meaning that someone has symptoms that can't be managed in the home setting, or they don't have the support they need in their home setting. And that is how we choose and help people understand whether they need to come to our inpatient units or not. Whoops, sorry. Care Connection, I'm sorry, I'm still on the programs. Care Connection is our palliative care program, which I don't know if you all know much about palliative care, but it is a lot like hospice, but it is not for people who are at a stage where they have a prognosis of 6 months or less. It is for people who have chronic diseases and they have symptoms related to that, and we use a lot of the tenets of hospice to provide symptom management and help them with understanding their disease and their goals of care. We do this program in a couple different ways. We have one that's just based in facilities, and then we have one that we do with home health for some of their patients. So this is a growing program for us, but it's a great way to help people understand more about and understanding more about their disease and being able to take control of their own care. So some of that self-determination. Our Kids Path program, that is a two-part program. It is actually a pediatric hospice program. We do have very few number of pediatric hospice patients, but the majority of the work that's done for Kids Path is for bereavement for children, and that is for children of patients or related to patients that we serve, but we also see children from the community also. Our Grief Counseling Center, of course, is similar, same thing, but for adults. And as I said before, we offer a lot of different services through that. In Kids Path and all of our counseling, those are non-reimbursed services. They are fully dependent upon our public support. People come and have counseling for free, and it is a community service that we offer. So, CareLink is our volunteer group of speakers who go out and do speaking engagements, Hospice 101 presentations, just to help folks understand more about what we do. And then lastly, Living Smart is our program that helps people understand advanced directives and how to complete those, how to make your healthcare wishes known. And we do these programs too, where we do an educational component, and then we help people complete their documents, their healthcare power of attorney and living will documents. Okay. So lastly, this is the last one. Why does hospice have volunteers and what do they do? This is on page 20. Hospice was started, which you may have heard this, but when hospice began, it was a grassroots effort started by volunteers. When Medicare created the hospice benefit, they saw the value in how hospice began, and they required that we have to 5% of all of our care hours have to be provided by volunteers. They worked that regulation into the benefit, which is very interesting in my opinion, but I think it's just really important, shows the importance of volunteers in what we do. You have an important role in our team. Hospice, so the Piedmont Hospice of Randolph, we usually double the amount of hours that we provide by volunteers. So volunteers are very active and very big part of what we do. And as you may have already learned and heard, volunteers do a number of different things for us. A great deal of what they do is provide, time with the family, a listening ear, sometimes respite, sometimes running an errand, providing transportation. Volunteers spend time at our IPU, visiting patients, working at the front desk, lots of different opportunities to volunteer. But that patient volunteer, and whenever we'll be able to kind of do that more regularly, it's really the most important of the jobs, I think, because people just really love that time with volunteers. It's a different person coming into their home that they can spend time with and talk to and get support from. So we've considered the Give with Heart concept, values, and we've considered about being an advocate, and then we've considered knowing your stuff and those things. So next I think it's just really important to consider your story, because people will ask you, people will give you an opportunity to tell why you're a volunteer. And so I've got a few questions just to prompt you. I encourage you to spend some time with this and take some time later to jot down your thoughts or really formulate some things that you want to be sure to tell people whenever they ask you about our organization. Like before, what is your connection to Hospice of Piedmont or Hospice of Randolph? Do you have a personal connection? Where you served? Was your family served by the organization? Why do you volunteer? Often, people volunteer to give back, to enrich lives, and I think so often people who are hospice volunteers have their lives enriched in return. And I just think that this is an important, I think it's great, to hear from volunteers just about the simple why do you volunteer. And then lastly, what do you think is the most important aspect about hospice care that others should know and understand, and what hospice myths can you erase? As you can imagine, there are so many misconceptions, and so I hope that learning, even going through these FAQs, that you're hearing things and learning things that you hope that you can share with others to understand. So lastly, I just want to wrap up my time with what we hope will be your commitment. As a volunteer to our organization, we hope that you will commit to grow, inspire, value, and empower. Be an advocate for our organization, and to understand our organization's missions and goals. And as always, I'm available to answer questions about giving specifically, or just about how to understand more about what it is that we do. And I'm available by phone or by email. And I appreciate your time today. I would love to take some questions if anyone has any. Happy to answer questions. Okay. Can you unmute? There you go.
Okay.
There you go. Yeah.
Maybe more of an observation than a question. I'm finding that since my association with hospice started a little over a year ago, that there are so many people who do, I'm sorry for the beep, who do not understand that hospice is not a death sentence. And I was in the hospital when someone from Hospice of the Piedmont came to the room and said, have you and your husband considered palliative care? And my brain went right to palliative care, that's hospice. Wait, we're not ready for hospice. Yeah. And, I had to be educated, and then they just saved my life. Really. Oh, Well, it's just an observation. I have a friend right now whose husband is um, really needs her 125% of the time. And I mentioned palliative care. She did not know what that was. I said, well, don't feel bad. You know, I didn't really understand it either. Um, but I've tried to get her to call, and no way. Her husband is not about to die. No way. I've tried to gently help her through that misunderstanding, and I'm getting nowhere because that's just her impression. Hospice means death. And so I'm just, it's an observation that there really is a need in the community to understand what it's all about.
You're exactly right. Exactly right. It takes just each of us just learning a little bit more and you planting those seeds and sharing when you can, to help people to understand better. Palliative care is huge, and I tease, but it's really not teasing. It probably took me 3 years of working here before I really could wrap my brain sort of around what it really was. It's a big concept, and yes, it is hard to separate for a lot of people from hospice care. So it's like we've said before. Let me think. I might say it wrong. Hospice care is palliative care, but palliative care is not hospice care.
There you go.
Meaning, what hospice is doing is palliative, but not all palliative care is hospice care. It can be for people, even if they're not imminently dying or, like I said, going to die within the next 6 months or whatever. So, yeah, we believe there's value in a lot of our symptom management that can be so beneficial for folks who are doing things like taking chemo and are suffering from some rough side effects of things. We think that our knowledge and understanding of what we do in hospice can help those people sooner. So that's what we try to do with that program. Yes.
How often do you have a public, I mean, okay, I know with the pandemic, let's talk about before COVID. How often do you have public speaking engagements and conversations? How are those discovered? Do you wait for an organization to come to you to ask about those, or is someone overseeing those speaking opportunities?
It kind of happens in a variety of ways. We have folks that are seeking speakers, who seek us out, and we also the volunteer department is part of community engagement and education, and so their goal is to do some of these talks and such. So going out and finding some opportunities, but also the Care Link group that I mentioned in our programs. It is a group of specific volunteers who have extra education, and have taken a presentation we created for them basically, and they go out and they give the presentation in their own way, tailored to their own way. But they do some of that for us. So we have sort of a mixture. Like I said, we have people calling all the time saying we'd like a Hospice 101 presentation. We kind of call it a Hospice 101. It's just an intro to hospice.